Okay, Lindsay, so I want to talk to you a little bit about some of the pain you're experiencing. So I know that you received an MRI that showed some mild degeneration in your cervical spine, but I just need you to know that there is no correlation between tissue damage that shows up on an MRI and pain. So the mild degeneration that we saw in your cervical spine, it might be causing your pain, but it might not be. So we need to do a little bit more investigating to figure out if that's the root of your pain or if maybe something else is, okay? And I know that you said you have been experiencing pain for the past couple of years. So when you damage tissue in your body, depending on the severity, it can take a couple weeks to a couple months for that tissue to heal. So even if you did injure your neck years ago, that tissue's healed by now, and you're not going to hurt yourself by just moving around in your day-to-day life. I know it causes you pain, but you're not damaging any tissue from moving around, okay?
Okay.
I'm going to share my screen with you, and I'm going to show you what might be going on that's causing your pain. So we can think of the pain as like an alarm system, and you function your day-to-day life down around here below this threshold of pain. And then when you say you stub your toe, well, your neuron is going to send a pain signal to your brain, and it's going to cross that threshold, and your brain is going to say, hey, we're in pain. We just hurt ourselves. We need to be more careful. We need to maybe go sit down, take a look at our toe, make sure everything's okay. And that pain signal is alerting you that you might be damaging some of your tissues. And then normally it should settle back down to this normal level. And so you have lots of room to do lots of things throughout the day without any pain. Well, sometimes after we get injured, our neurons don't return down to a normal level. They become extra sensitive. And instead of coming all the way back down to here, they're now functioning up here. So now you're going about your day, and even the smallest, lightest sensations are causing us to cross that pain threshold and sending signals to our brain, and our brain's interpreting them as pain. But maybe you're just hugging your mom or something. You're not actually damaging any tissues, but your neurons are so sensitive that it doesn't take much to send that signal to the brain that's interpreted as pain. So that could be what's going on. And it's not uncommon. About 25% of patients recovering from an injury will develop these hypersensitive neurons. And a lot of times, some external factors in our life can make us more likely to develop these sensitive nerves. So stress, anxiety, financial stress can make it more likely that your neurons are going to become extra sensitive. So addressing some of that stress and anxiety in other aspects of your life, going and talking to a therapist or doing whatever you can do to address that stress and anxiety can actually help reduce some of your neck pain. And, what you and I are going to do is just going to work on calming those neurons down and making sure that the brain knows that, hey, we're moving our neck, but we're not damaging our tissues. We're just doing normal movements and we're not hurting ourselves. Does that make sense?
Yeah.
Have you thought about going and talking to someone about some of the stress and anxiety you're feeling?
Yeah, it might be a good idea because I get awfully worked up over my grandma and my life at home.
Yeah. And I think, like I said, a lot of times when people take care of some of the external factors, it really helps relieve some of that pain and calm some of those nerves down. So I think that would be a really good idea. But you and I are going to work during our sessions to try and calm those nerves down as well, okay?
All right.